Welcome, everyone. Thank you so much for joining us today. We're just going to hold on a minute while our platform is letting everyone in from the waiting room. We are so happy to have you joining us here today. Feel free to use the chat to give us a greeting, say hello, let us know where you're tuning in from today. You'll note as you're being let in that your cameras are automatically off, you're automatically muted, which is how it will stay throughout today's presentation. So we encourage you to use the chat to communicate throughout today and give us your greetings in there, and feel free to ask questions throughout today in the chat as well. Oh, wonderful. I see those coming in. Hi, everyone. It looks like we have people from all over, so welcome, welcome. Fantastic. Well, thank you all for joining us today. We are here for our part 2 of our Prioritizing Healthcare Worker Emotional Well-Being across the country. I'm Jackie Zimmerman. I'm our Public Education Associate from MHA's National Office, and I'm joined today also with Jenny Sanchez, who is another staff at our national office, as well as some wonderful individuals from our affiliate network that are here to share some amazing programs with you today. So I have just a few housekeeping notes before we jump into things. This webinar is being recorded and will be emailed out to all registrants within 1 week. Anyone who registered for this webinar, you'll also receive the recording from yesterday's webinar in case you weren't able to join us for that. We currently do not offer CEUs, but you can request a certificate of attendance. I'll post the link to that certificate in the chat here shortly, and that'll also be included in your follow-up materials. We don't have built-in time for Q&A today, but we would love to answer any questions you have. So feel free to post those in the chat, and we'll be collecting them, and answers will be included in those follow-up materials. So with that, I will hand it over to Jenny for another warm welcome.
Thank you, Jackie. Good afternoon, everyone. And thank you so much for joining us again today for this 2-part webinar series. And again, I'll just reintroduce myself. My name is Jenny Sanchez, and I'm the Director of Grants Management and Projects for the Mental Health America's National Office. And I'm delighted to be with you all today. Today, you will hear from the Mental Health America in Montgomery, who piloted Help for Support Staff through a handbook that they'll share. The Mental Health Association in New York State, who provided life coaching through the MHA New York State Care Path program, and Mental Health America of Greater Dallas, Workplace Wellness for Hospitals. And at the close, we will discuss some of our findings from the national office after going through these pilots with our wonderful affiliates. And so stay tuned. Right now, I'd like to turn it over to Julie Waters and Cynthia Bisbee from Mental Health America in Montgomery.
Okay, I'm Julie Waters, and first I have to say thanks to the Brave Apart Fund and Mental Health America for supporting frontline healthcare workers and their families by providing us a grant where we were able to provide design a free toolkit to help with mental and emotional coping resulting from the stress of working on the front line of the pandemic. To start, why did we think this project was important? Well, 80% of healthcare workers are non-medical frontline workers. Those include people like nursing assistants, janitors, maintenance staff, and food service workers. Administrators, social workers, and clerical workers are also included in these numbers. These 80%, for the most part, are the lowest paid employees and are often undervalued in our healthcare system. And therefore, they experienced extreme stress during the COVID pandemic. They are disproportionately women and people of color. And they are really our unsung heroes who kept our healthcare system stable and patient-centered during the pandemic. So some of the mental health and emotional issues that increased during COVID-19 pandemic were extreme stress, anxiety, depression, PTSD, and substance use disorder. According to the Pew Research Center, at least 4 in 10 US adults have faced high levels of psychological distress during the COVID-19 pandemic, up from 1 in 10 in 2019. Situations such as having trouble sleeping and feeling anxious were the most common reported feelings of distress. Experiences with depression and loneliness were also highly reported. In the most recent survey in September of 2022, 46% of adults said they had felt depressed at least 1 to 2 days in the past week, and 42% said they had felt lonely. The World Health Organization says that the COVID-19 pandemic triggered a 25% increase in the prevalence of anxiety and depression worldwide. All of us know that the COVID-19 pandemic created a mental health crisis, not only for our healthcare system and our communities, but also in each of our personal lives. So this 45-page handbook is written at a low literacy level and is simple and easy to read. It's easy to follow. It's an interactive, self-motivating guide to help someone decide if they need to contact a medical professional or if they need to learn new coping skills. As you see on the slide, you see the toolkit cover. Actually, we call it a handbook. We started out calling it a toolkit, and I'll explain later, but we call it a handbook now. Some of the sample topics that were covered were mental and emotional well-being, stress and anxiety, what is depression, what is self-care. There's a section that is specific to men and men's mental health, resources, and then as I said, it was an interactive toolkit. That was our goal. And because of that, there are sample activities throughout the toolkit, such as identifying your symptoms, coping with stress, what are depressed thoughts, and identifying depressed thoughts, using coping skills and identifying coping skills that work for you personally, deep breathing exercises, how to journal, what is your daily self-care routine, and defining your village. As you all know, we can't make it all by ourselves, and this helps people to understand that they need to define the people for their support system and learn how to ask for help. So where were our healthcare settings that we targeted for toolkit distribution? Well, we started out really trying to target the hospitals and then other healthcare facilities such as community health, home health agencies, social work agencies, nursing homes, and assisted living. Requests as we went through the project were also made to distribute the toolkit to family caregiver programs. As many of you know, family caregivers were frontline workers during this pandemic, and they really are all the time unsung heroes that are there to take care of people. So what were some of our successes? And as I go through the next few slides, I want you to pay attention to the little graphics that are on the side, and I'll read those because these graphics are examples of the social media posts that we used. And they are also examples of some of the, gives you an idea of the graphics and some of the things that we talk about in the toolkit. So the handbook results, we had 1,995 people visit the toolkit digitally. They visited 2,148 times. We distributed 2,652 printed copies. We had 145 posters that were distributed and posted mainly throughout nursing homes and assisted living and doctor's office and some home health care agents. Facebook, our audience reached was 49,805. From those 49,805, 1,487 pressed the link to the toolkit. And we did a very easy, simple survey to gather data and to try to gather stories and other information. And that from those survey responses, we got 866 responses. So this little saying says, when thinking about asking for help, ask yourself, do I really need to do this alone? Learn how to ask for help. Download our mental and emotional well-being toolkit at boktoolkit.org. So a few other successes. Our goal was to reach 350 frontline non-medical workers. We partnered with the Long-Term Care Ombudsman Program, and they distributed toolkits and break room posters to 1,641 individuals in 11 South Central Alabama counties. Some other successful partnerships that we had were that we shared the virtual toolkit and social media posts with Alliant Health and their national COVID-19 resiliency network. This resulted in 3 network postings in their monthly newsletter from November through January. And that those postings that had access to the toolkit virtually went to approximately 21,000 individual healthcare contacts and 18,000 organizations nationwide. This resulted in large numbers of individuals visiting the boktoolkit.org in a larger survey and larger survey results. They also use some of our social media ads and help to facilitate meetings with the Alabama Hospital Association and the Medicare QIO. This partnership did help jumpstart our project. We did not have, I think we had about 60 survey results, and this increased our survey results dramatically. It was just an accidental partnership that happened when someone saw the toolkit, and we were very grateful for the partnership. Turned out to be a good partnership then, and the potential for the ability to partner in the future with more community health organizations in our region. So this little section says, do not wait for your doctor to bring up your mental and emotional health. Get tips for speaking to your healthcare provider. So we have one section also that talks about how to talk to your provider. So some other successes where we had several presentations and media coverage. We had a staff presentation on the toolkit and how to help distribute the toolkit in healthcare facilities with one of our partners, the Wellness Coalition. The Wellness Coalition, through their REACH CDC grant, sponsored a free online event on Be Okay, Coping Skills for Your Mental Well-Being. It was a 45-minute presentation on Zoom and Facebook Live. We did a presentation on holiday stress and using your Be Okay handbook that was presented to 75 DHR social workers. And we did a Be Okay and holiday stress interview with Troy Public Radio Station, and it was then used for a podcast for In Focus with Carolyn Hutchinson. Just recently, the Alabama News Network produced a series on mental health matters, and they interviewed the project manager to discuss mental health coping skills, and they will air information about the toolkit on May 11th in 4 Central Alabama television stations. And then they will provide the presentation to us to be able to use for various media for Mental Health America in Montgomery. So these are just a few of the presentations that were given during the project timeline. And one lesson that I think we learned was that this toolkit works better when you can give a presentation to a group and then hand out the tool. Also, here's another media. If you are feeling stress, grief, or anxiety during this time, you are not alone. So what were some of our challenges? Well, we did have some challenges. First of all, the timeline, for everyone, I think was a challenge, but that challenge was resolved. We were given more time, but it seems like we're just getting started with the project and it's ending. And so that's quite a challenge. Collaboration, it was extremely difficult to get stakeholders who were, before COVID, easy to work with and easy to partner with, to get people to answer email. And that was difficult during this process. And so we had to rethink some of our strategies to get the toolkit where it needed to be. We used community health workers, social workers, and ombudsmen. They were our best allies. And they also were asking for help and were there on the front lines during COVID. And so I think they experienced the toolkit personally, and then they were willing to help to get it out in the. Having the virtual toolkit is a huge plus, but it's also a challenge because it makes, we have the virtual on the website that we can follow, but we also have copies that can be emailed that are fillable PDFs, and those are more difficult to track. So it makes it difficult to actually know how many people are with, but it also makes it easy to replicate. So mental health services are a real issue. It's a challenge to ask people to seek mental health services when there are long waiting lists and very few providers. It was a great opportunity to share the new resources of 988 and to talk about what to do while waiting, but it is difficult for mental health for people to get the mental health they need in a timely manner. The survey, we used incentives and had a short survey, and initially it was difficult to get people to complete, but at the end we did receive a good sample of the surveys with positive results. Healthcare was a challenge. Many healthcare professionals expressed that mental health is the #1 reason people have left the healthcare field and to expect more to leave in the future. I think that is a very important thing for us to take in the future from what we've learned from this project and probably all of the projects. It has been suggested that to replicate the toolkit, it's been suggested that we redo it and call it a handbook and not focus as much on the pandemic. The Hospital Association really was not positive about us focusing on the pandemic and wanted us to just focus on the message on mental health and mental well-being. So it's a challenge to find continued funding when there are so many avenues we feel like we could use this handbook to help others. And I think our biggest disappointment was not getting the support of the associations who support the healthcare industry. They could have helped us to get more more handbooks in the hands of our intended audience, especially the hospitals. But the project ended, and really by accident, friendship, we are able to get one hospital at the end to commit to distributing 400 toolkits in May. So we feel like that's a challenge that turned into this. So how do we replicate this project? First, let me read the message here. Mental illness is real and treatable. Learn how to identify your symptoms. So one thing we also did in this toolkit was make sure we made it very clear to people there's a time to see their doctor. And that's where learning how to identify your symptoms works. So with minimum resources, we feel like this project can be replicated. The printing ranges were very different for us. We were able to get a great price on 3,000 color copies at 48 pages each. And as you see, it's very colorful. That's typically very expensive. But each copy with the printer that we were able to access printed for $1.32 a copy. So if someone was to replicate this for a local area or another state, they would need to adjust the cover, the back, the inside cover page, and the resource page to localize the handbook. And we could probably put interested parties in touch with our graphic design consultant if they were interested. But he would probably not. And the virtual copy would also need these changes, but would not require the printing cost. But this project could also just be shared through our boktoolkit.org link, and those requesting can have access to social media ads that can be posted on social media and website pages. And the toolkit or the handbook itself can really be replicated without the changes, because the majority of the resources in the back of the handbook are national resources. So the project is would be easy to replicate or share. So what was our return on investment? The total number of people served with the handbook was 4,647. The return on the investment would be $10.53 per person. And the indirect cost per individual would be calculated at $32.97. The impact on marginalized communities, we know that we reached our intended population in the 11 South Central Alabama counties where the ombudsman helped distribute these handbooks in nursing facilities. These employees are mostly non-white, They have a higher poverty level. They were rural and typically mostly single Black female. So our survey results, we had 866 total responses. Did working during the pandemic add to your stress? 89.84% answered yes. Did the Be Okay handbook increase your knowledge about mental well-being? 92.90% said yes. Did the Be Okay handbook help you deal with your mental and emotional well-being? 89.67% said yes. Again, here's another social media ad. Self-care activities are things you do to maintain good health and improve your well-being. The last two survey questions were, did you talk to coworkers or family about the information in the toolkit? 84.68% said yes. Did you contact one or more of the resources listed in the handbook? 69.12% said yes. And then this is another sample. Journaling is a great way to organize your thoughts and calm your mind. Get more tips in our mental and emotional well-being toolkit. So I'd like to end with that it's important to treat yourself the way you would treat a good friend and learn about how to accept yourself with the Be Okay toolkit. And if anyone is interested in more information, Cynthia is going to put information in the chat about how you can contact Mental Health America in Montgomery and how you can access Be Okay toolkit. Also, we would encourage you to sign up for our roundtables and for our monthly newsletter. Thank you for the opportunity to share this wonderful project with you today.
Thank you so much, Julie. And now I'd like to turn it over to Deborah Faust from Mental Health Association in New York State. Deborah?
Thank you. Just hold on a second. I want to make sure that I have the right. Okay. Is it okay? Am I up okay?
Yes, perfect.
Oh,
Deborah.
Okay, thank you. Before I get started, I just want to say, Julie, wonderful, wonderful presentation. And I love that the name of the toolkit. It's okay to not be okay. I just love that. Very, very exciting work. My name's Deborah Faust. I'm the director of Mahaney's Care Path program, and I'm excited to be here. And I'm more excited that Mahaney's Care Path program was selected to be one of the programs, the 5 programs selected across the country. You know, I've said that to anybody that will listen, and I'm just really happy about this experience. It's been a learning experience for me. And just hold on a second. I'm just adjusting my camera here. So I'd like to tell you a little bit, before I go any further, I'd like to tell you a little bit about the Mental Health Association in New York State, or as we like to refer to ourselves as Mahaney's for short. We do strive to end the stigma against mental illness, and we start conversations about mental health and promote mind, body health and healing in everyday life. And we do this through a variety of different ways. We do education trainings, advocacy, working in communities and connecting people and families to the help they need. We have 26 affiliates across New York State that provide services and supports within 50 counties throughout the state. And I do want to mention that in 2020, Mahaney's drafted a legislative issue brief that outlined 6 recommendations for supporting frontline health and mental health care workers. The governor signed it and commissioned a task force that will respond to those recommendations listed in the legislative issue brief. And I mention this because one of the recommendations was to support frontline workers and their families. And thanks to Mental Health America and the Brave of Heart Foundation, we've been able to offer CarePath. And that's been an exciting accomplishment throughout the state. And before sharing the outcomes generated from this project, I want to give you some details about the program. As a person myself with lived experience managing my own mental health and a daughter with a more serious mental health condition, CarePath has brought family mental health to our attention. And quite honestly, it helped us discover the best protective factor for recovery and enjoying better overall health, and that is family mental health. Mahaney's CarePath program is a non-clinical program, and although there isn't any direct focus on diagnoses, there are cognitive behavioral techniques for self-management tools embedded throughout the program. CarePath supports the idea that recovery can be undertaken by the whole family. When each person in the family is focused on defining their own mind, body, health, and healing, the outcome results in a wellness mindset. And my personal opinion is that a wellness mindset is the most influential aspect for managing any type of mind, body, health condition. Oh, excuse me. I want to just go back a minute. I didn't read the slide. The slide it shows you that this is a program that assists youth that are 12 years and above who are managing their behavioral health needs. And a certified CarePath coach will offer support for 90 days to the person in recovery and their family or other chosen supporters. And the person in recovery gets to select who they'd like to be in the program with them. And as I mentioned earlier, they're all going to engage in the same activities in defining their mind, body, health. And so ultimately, Mahaney's CarePath supports intergenerational family mental health, because when they're in that room and they're all doing the same exercises facilitated by their CarePath coach, they're also learning all of the multi-dimensional ways that mental health expresses itself and all the different needs of mind, body health. Mahaney's affiliate network and beyond were offered to attend one of the 6 week-long trainings for certification. Coaches certified represented 18 counties across the state, and all 5 regions of New York State are represented within these 18 counties. These counties listed below reflect urban, rural, and the most vulnerable counties with the highest rates of poverty and immigrant and refugee families. And as you can see, Brooklyn, the Bronx, Staten Island, Queens, Manhattan, Albany, Saratoga, Oneida. There's so many counties here that reflect the central region of New York and the western region of New York and Long Island. So as you can see, this is a very diverse group of counties, and we really are very, very happy that all 5 regions were represented. This slide highlights the demographics of those certified in the CarePath program during this project. And this slide is indicating their gender, race, age, and primary language. And what's interesting to me is 5.5% of folks identified English as their second language. And another interesting fact was that our coaches ranged from 20 years old all the way to 71 years old. So I think some of these statistics are very interesting. But I'd also like to add that 38 coaches identified themselves as peers, meaning people with lived experience managing behavioral health concerns, and 75% identified as frontline health and mental health care workers. This demonstration project has afforded an opportunity to support families from all kinds of diverse settings, as this slide is indicating. Coaches certified during this project are bringing back a new program, not just a training, they're bringing back a new program to their agencies. And it's interesting to note that all the services listed on this slide are frontline health and mental health workers. For example, coaches certified during this project are offering services to the LGBT community. to those living in supportive housing, adult homes, faith community centers, immigrant and refugee family centers, veterans, adult with end-stage diagnoses, foster care, reentry, people experiencing domestic violence, sexual assault, reentry programming, EAP programming, traumatic brain injuries, intellectual and physical disabilities. Mahaney's is so grateful for the long reach that this project has afforded Mahaney's CarePath program. This slide captures our successes and our challenges. I want to mention that CarePath is typically a fee-for-service training, and only through funding such as this is it possible for some folks to become certified. So we were very excited to be able to offer more than 50 coaches to be trained. Basically, this proposal was really rooted in a training grant, and we proposed 50. So 72, we were really excited that we were able to do that. And we shouldn't have been surprised that the material within CarePath would support workforce wellness. And it was so gratifying to be able to support the health of frontline workers, because our testimonials about how CarePath helped them manage their own mind-body health needs resulted in workplace wellness, which I think is critically important. And even in Julie's presentation, it was mentioned. The diversity of service settings resulted in a diverse group of professionals and paraprofessionals certified as coaches. And again, these professionals and paraprofessionals are bringing into the conversation family mental health into the existing services that they offer. And then we also learned from this project that there was a need to modify CarePath for group settings to ensure more versatility. Some of the challenges were the 90-day timeline. This is a program that offers support for 90 days, and that posed the biggest challenge of all. The health of our New York's frontline healthcare workers presented another challenge. Again, I think all of us that were part of this project, all 5 programs, have talked about this, and it's all across the country. And all across the country, the workforce shortages were evident in all areas of our outreach of frontline healthcare workers. And then the 6 week-long trainings were offered and ended in September, the end of September. And then another late start happened with the marketing. And we really were depending heavily on the marketing of training, of getting this kind of messaging out across the state about a training that was going to ask their leadership at these agencies to send staff to a training that could, that is a week long. And that itself presented some challenges for us. And setting up a 90-day program within an agency and within a community requires a few months of soliciting referrals and getting that community to even understand this new opportunity that they're going to have. So those were the biggest, but I would have to say that the biggest challenge for us was the 90-day timeline, because it really interfered in our ability to capture the kind of data that we were interested in capturing. And due to the staff shortages, and staff now wear so many more hats than they may have before the pandemic, those that attended the training suggested that a need for more program versatility. The MHA America, the support from MHA America and the Brave of Heart funding provided us opportunities to modify the program. And in my opinion, the result is a more efficient program. Mahaney's CarePath has a manual that outlines how to facilitate all of the different options listed on this slide. That program's original model was really offering 5 to 10 sessions throughout 90 days with an individual in recovery and their chosen family members or friends. So now what we've offered is you can take those exercises that are within those sessions, and you can put them into a support group format and offer 10 weeks. and you can offer that to individuals managing recovery and their chosen families with other CarePath families, or you can offer support groups for peers managing their behavioral health concerns with other peers. So there's flexibility in the group, support group format. But what really excited me, especially for the hospitals and a lot of faith communities, etc., is that you could also offer a CarePath wellness seminar. You could offer 5 weeks of a seminar and take those exercises and messaging that are involved in all of those sessions and put them out into a week-long, messaging throughout hospitals and throughout correctional settings, supportive housing, or centers that support youth, etc. So to me, I found that to be an exciting way to use CarePath as well. So we listened to the recommendations of the individuals that took this training throughout this project. And like I said, I think we ended up with a better program. Scalability. Mahaney's CarePath instructors, the way that I see scalability is through a train the trainer model, right? So if Mahaney's CarePath instructors select and offer certified CarePath coaches an opportunity to attend additional training to qualify them to become one of Mahaney's CarePath instructors. Mahaney's is going to always be the lead agency for offering training for CarePath instructors. And some of the guidelines for being, for accepting an application to become a Mahaney's CarePath instructor would include that a certified coach is actively using the program for at least a year or more, and that a CarePath coach is in good standing. And what I mean by good standing is that they're attending, the Friday forums, that they're reaching out for technical assistance. They're coming to our events and our annual summit that brings together all CarePath coaches across the state. So these are some of the ways that I think the scalability is there to offer a train the trainer. And I think about how if each MHA affiliate sent one CarePath coach to become a Mahaney's CarePath instructor, then they can respond to their community's needs throughout the state. So I think it's a really great fit and wouldn't be that challenging to do. I think the biggest challenge, though, tied to the scalability of CarePath is leadership investing in moving the program out and, more importantly, supporting their coaches. So, we all know that agencies are scrambling. I know that, all agencies that I've been in contact with this year, they're scrambling to get back into some sense of where they were before the pandemic. The economic impact. This is a program designed to offer support not only to the individual in recovery, but also their family members or other chosen supporters. So this slide defines breaking down what the economic impact is per family and per participant. Direct cost is calculated from each coach offering 3 individuals and their family members CarePath. So 72 coaches times 3 families equals 216 families served. So 216 is divided by the grant amount and comes out to $434 per family unit. And the indirect cost is calculated by multiplying the 216 individuals that will be served times 3, because typically an individual may have 2 family members attending the program. So 216 times 3 equals 676 people. So then we divide the grant funding by the 676 and come up with $139 per person. So ultimately, the direct cost is all about what it would cost per family unit to participate in this project. And then the indirect cost is how much each person, $139 per participant during this project. So I hope that clarifies the economic impact. And I thought it would be helpful to share some of the testimonials. I am so pleased by the testimonials that we've received, and we received more than we thought we would, which is always a great sign. The first testimonial is I've been using the Mahaney's Care Path in both my professional and personal life. It is very helpful to gauge my own wellness temperature before I begin my day. As a registered nurse, Mahaney's Care Path created an awareness of how to support my own health and well-being. The patients had asked for a group that focused on wellness and managing depression and anxiety. And once I found the Care Path program, I wanted to be trained as a Care Path coach. Working with diverse cultures, I gained a lot of knowledge regarding mental illness and the cultural differences on how families regard mental health. And Mahaney's Care Path has changed the way I think about self-care. I now understand how the practice of self-compassion provides self-care. So as you can see, I tried to select ones that would, give you an understanding of different ways that Care Path really speaks to people. And, we, within the program, we really do train quite a bit on the practice of self-compassion, because we know that people that are managing behavioral health concerns have been stigmatized or maybe left with some self-stigma that they're trying to, get past. So the practice of self-compassion is very important in managing our mental health and well-being. And I was happy that, those in the direct healthcare field found that this program supported not only the folks that they're going to support, but their own health and well-being. Many coaches certified through this pilot were grateful for the certification and the opportunity to focus on their own mind-body health and the health of their family. We heard that over and over and over again. This program came to them at the right time. And this project supported workforce and professional development, as the training provides 20 renewable credit clock hours to New York State certified peer support specialists, family peer advocates, youth peer advocates, peer bridgers, which happen to work right in the hospitals in New York State, and KSAC counselors. For those of us that have or are working in direct care settings, we know just how important our own health and well-being is when we're trying to support others. In Care Path, we trained that as human beings, we co-regulate our energy, and to provide a safe emotional space for others requires us to be aware of our own health and well-being. And Care Path brings a wellness perspective that is very organic and comes through modeling. And so when you go back to your agencies as a coach, you're bringing back a lot of skills that can be modeled to the rest of the staff and to those that you're serving. So with that, I just want to say thank you for attending this presentation, and please feel free to reach out and learn more about Care Path.
Thank you so much, Deborah. And now I'm pleased to announce Bonnie Cook from Mental Health America of Greater Dallas to present.
I'm not able to start my video because the host has stopped it. And I can talk without you seeing me.
Bonnie, try your video now. There we go.
We got it. All right. Well, good afternoon, everyone. I hope you're having a great week. I wanted to talk to you about Mental Health America of Greater Dallas's project. We started off with this project and we wanted to change the world. we wanted to make a difference in the actual systems of hospitals and mental health care. So we envisioned a project where it had 3 prongs. One prong was working with C-suite executives in hospital settings and educating them on how to be a good manager, talking to them about what it was to have a mentally healthy workplace. Then the second prong was to work directly with the employees and talk about how do you deal with your stress, how do you deal with your particular anxieties, and what you do from there. And then the third prong would be exhibiting at different events and giving out the literature and things that we had. So backing up to COVID, and when we received the funding, and then when we started implementing the project, there was a big concern about mental health care and the struggles that healthcare workers were facing. So we knew that this was going to be a fabulous, easy project to implement. So I'm going to share my screen now. Their screen. You can't see it, can you? It's saying that Zoom needs to do something with preferences for me to be able to do that. Okay, I'm going to talk about the project, and we'll just go from there. So you all are going to have to listen to me as opposed to see a presentation. So what we did as an organization is successes. And like I said, we thought this was going to be so easy to accomplish. So the first thing that we did was we created custom magnets with QR codes that link to MHA's screening data. And for those of you that don't know about the screening data, you can go, can you send the PowerPoint for all to share? Whitney is on the call, so Whitney's going to try and share that presentation. I think if you would go ahead and send it maybe to Jenny, then Jenny can get it to where it needs to go. So anyway, so we were going, so if you're not familiar with the QR codes, with the screenings, if you're not with MHA National, you can turn around and you can take those anonymous online mental health assessments. Well, you have to direct people to get to those assessments. So if you can't get to those actual assessments, then people don't know they're there. So what we did was we created this right here, and it's a magnet. So all you have to do is click the QR code, and when you click the code, it goes directly to the website. And we could give these out. It was portable. They could take it anywhere that, you could take it, you could slap it on a file cabinet and do however you wanted to get access to those screenings. So we also created, and this has turned out to be one of the best things we've ever done. We started using it for workplace wellness. And then when we do presentation booths and did work, with other type organizations and some of the other things that we do at MHA, I had a few of them just, kind of sitting there. Everybody took these. So we were very excited about that. Then something else we did, we created workplace wellness postcards, and the postcards were very simple, things that some of us already know that we're supposed to do, and making sure that they were aware of the challenges of working. And then as the project went on, we started struggling with getting the word out. I'll talk to you about those challenges. So to address how we were going to make sure that we were getting to healthcare workers, we placed an ad on KERA, which is the NPR affiliate here in Dallas. Now, you think that's a very expensive thing to do. But in our area, and I would suggest you check it out in your areas, you could get 30-second spots and run. Oh, here we go. I love these people. We could turn around and run 12 30-second slots for $1,200. Now, for this $1,200, you don't get the prime, drive time. We did get the prime drive time and go home time twice. And so, like I said, if other affiliates, other people, other nonprofits on the call, they might have that particular ability for you to do that. So I would suggest you reach out. We can also send you our contact, and maybe they would know the information for you to do that. So, and to get that done. So I was very excited when I did hear one. It was MHA of Greater Dallas supports NPR, providing workplace wellness for healthcare workers. So like I said, that was another one of our successes. We did present to 6 healthcare organizations on select workplace wellness topics. When we started the project, it was like, okay, we're going to do workplace wellness. Well, when you start talking about workplace wellness will mean different things to different people, and depending on the demographic of who we were serving. So if we were talking to C-suite, we needed to talk more about how you deal with issues related to employees' absenteeism due to depression. If you're talking to an actual employee, it was like managing your depression while you're at work, dealing with your stress as you go through all these new changes that we all had. So then we had to go ahead and create. So, you thought you could have one presentation that you could do with one audience and then you'd be done. So, that did not work. So we ended up creating some handouts and fact sheets and different presentations to give to different audiences. When we sent out the email, on a constant contact, and from the list that we already had, to say that we have special trainings available to healthcare workers. They're free. We want to support you. Reach out. We have probably 20,000 people on our distribution list. Well, we sent it out and people responded back, but they weren't healthcare workers. They were other workers. So I couldn't say no to doing a presentation if somebody is reaching out and wants a presentation. So I did 10, 12 presentations on workplace wellness that was not directed toward this grant because we had started to spread that word in the realization that everybody was struggling as they returned back to work. Okay, next slide, please. Okay, so because of the KERA NPR radio ads, we had a 6% increase in our web traffic to the Workplace Wellness website that has been put in the chat. We also did some Facebook targeted ads, which garnered 21,836 viewers. And then we had 284 people click through to the Workplace Wellness website. Next slide. Okay, so like I said, it was a very successful thing for us as I talked about, what we're going to do with NPR in the future, what we're going to do as an organization with these magnets. And so there was an exciting time, and it was fabulous to receive a grant. And I do thank the Brave of Heart that you got money that could help you hire somebody to help you do some of these projects, because we all know that grants do not cover employee salaries. And so when you're trying to do a project, well, I can tell you the project, but I need the person to do that. So that was another exciting thing for us. So the challenges, and we had several challenges with this project, and my delightful, wonderful colleagues shared some of them. And I really agree with everything they said of their challenges in their affiliates was similar to the challenges that we faced here in Dallas. As I started off, I talked about that we thought everybody would want to jump at doing these wellness presentations, because at the time when it started, that's what we were hearing on the news, and that's what we were hearing, was that workplace hospitals and doctors' offices, everybody was quitting. They couldn't handle the stress. They couldn't manage the stress. So we thought this would be a slam dunk. We contacted the Texas Medical Association. We contacted the Texas Rural Association. We contacted the Texas Nurses Association. We contacted the North Dallas Hospital Association. And then also reached out to the CEOs of different healthcare organizations. And I did present at one conference talking about CEOs and talking about workplace wellness. We started finding out that there was competition in the for-profit sector that handled comprehensive wellness programs. People as a whole really are just starting to grasp the idea of workplace wellness. Just starting to grasp the idea of, is there a different workplace wellness as to what my home wellness is? So what was happening, and what is still happening, is if you've got workplace stress, you go home and you get on these apps that you can do for free, or you reach out to your EPA program. And when you reach out to those, that covers what it is we were trying to get across. So we then started trying to market as, look, if you did prevention before intervention, if you talked about mental health, before we're in the crisis mode, we all know if we treat mental illness, what happens. So we thought, okay, this is a program. When you do this, you don't have to go to your employee assistance program. You can start right now talking about a work-life balance, talking about the changes that you might want to implement in your life. We still couldn't get the world changed like I wanted us to change the world. All right, next slide. So it cost us $14.48 per person to implement this, and that included the printing of all of the magnets. It included the indirect cost, so staff time, individual time, printing time, and the NPR ads. I think through this project, as I said, we are starting to get the word out about MHA Greater Dallas. Because of the ad that was run on NPR, I had a writer from NPR reach out and want to talk about maternal mental health. So because they heard that ad, then that has opened another door for us. And again, these don't go right with the exact grant, but as a result of the grant, it is expanding out into other areas. We were really surprised that, like someone said earlier, that these organizations that tout associations and tout medical care and wanting to work for their employees, we could not get anyone to call us back. So it started then to be this cold call and this trying to find someone that wanted us to do the presentations. So when we realized that our target audience of hospitals was too big of a target, there was too much that you had to work through, too much then that you would have to figure out, because then we went to HR individuals in the actual hospitals. So we decided, okay, we're going to skip the C-suite people. We'll go to HR. And again, it was a struggle. So Whitney and I started cold calling people and saying, are you interested in workplace wellness programs? I didn't go into this job to do sales, but it became an issue of salesmanship. Are you interested in this program? And again, we got 6 organizations that let us come out and present. I think that the healthcare industry, like we mentioned, is understaffed. So also when you turn around and say, okay, we're going to help you with your workplace wellness, but this is going to take an hour or an hour and a half out of your day. And we wanted to be able to go in person to exhibit and go to places. And they said, no, we don't have time to do that. That is just not what's going to happen. So, like I said, so we started reaching out to smaller organizations. I went around and delivered a flyer about the program the old-fashioned way, and slid it under the door. So I'm hoping that someone would take us up on that. I did get a call this week about wanting us to do a presentation, but by now the grant's going to be over. And I think part of else that, again, we say that we care about employee mental health and we care about workplace wellness, but I don't think that as a whole, hospitals are quite ready to invest in that. And I think as anyone that would try to replicate this program that we've done, like I said, you can have our magnets. So you can make your own magnets, because this has MHA of Dallas on it. But you can get that done. That's not hard to replicate. But if you're planning to want to do presentations and want to do outreach to hospitals, doctors' offices, rural areas, Texas is a very large rural area. You're going to have a full-time staff person that is devoted strictly to trying to find those contacts. So we had, when we wrote the grant, we had some hospital contacts, and then we reached out and said, oh, you want to do this? Well, they quit. And so then, like I said, it was this starting over and figured out how we did it from scratch. So we turned around and revamped the program and our outreach at least 3 times during the year to see how we could make it work. All right, next slide. So you can replicate, like I said, I am so bad. I just talk through slides. We have PowerPoint presentations on workplace wellness that are already branded. So they're branded like this. Anybody could take this exact PowerPoint presentation template. We got the little logo of the bell. You just need to change your MHA to down here. If you are an MHA affiliate. If you're not an affiliate, of course, we are willing to share as long as you give credit to Mental Health America and Mental Health of Greater Dallas. We will be happy to share the workplace wellness presentations, to share the handouts that we use, and any other information that you might be interested in. The magnets cost us 68 cents, and that is because they gave us about a 35% discount on each magnet. Here in Dallas, they cost about $1 each to make. So in different areas of the country, of course, you would have a different cost. Okay. Next slide. So the impact on communities in Dallas. Any presentation that we did was given to any organization that worked with individuals who lived at or below the poverty line. And I found it quite fascinating that that was how it worked out. So as I said, when we started going to smaller organizations, if you're trying to go to large corporate hospitals, I personally don't think you'll get anywhere. And then when we started reaching out to like-minded organizations, like-minded not-for-profit medical centers, not-for-profit places and clinics that knew the struggles that we were all facing. And then we started getting in the door. So again, I would recommend that you look for like-minded organizations, but anyone that we worked with, they all served individuals at the poverty line or received some type of state or federal assistance. Next slide. Testimonial. When you do presentations, and when you do as many as I do, a lot of times you just don't know if it's hit the mark, if it was boring, if it was whatever. And you do want to know, and a funder wants to know that the program and what they funded makes a difference. That's common sense. So after I did one of my presentations, the CEO of the organization, and I was told he couldn't be there. Well, he was there in the employee portion of the presentation. And he came up to me afterwards and said that he had obsessive compulsive disorder and that he could not find a support group anywhere in Dallas or Fort Worth to share his struggles. And he volunteered to use our office and to start a support group on obsessive compulsive disorder that he was willing to lead. So he wasn't saying, you know, Bonnie MHA, you go out and do this. I'm willing to do this and to further the partnerships and the relationships that you have in the community. So I thought that was a great win for MHA of Greater Dallas, and showed that, yes, that we made some difference in this world. Some actual numbers. We ended up serving close to 30,000 people with the grant between the viewers that were targeted, some of the click-throughs. We had 3,737 healthcare individuals complete the screenings, and that was just healthcare workers. When we started giving these out, and I won't take up grant time for this, our numbers shot up to 5,000-6,000 a month taking these screenings. So that is what we have done at MHA of Greater Dallas. I apologize for the technical difficulties, but I hope I covered what needed to be covered as best as possible. So thank you.
Thank you so much, Bonnie. And thank you again to all of our affiliate presenters from yesterday and today for your work and for sharing all of this information. It was very comprehensive, and I've seen some good dialogue happening in the chat, so I'm pleased about that as well. As a reminder, all registrants will receive the recordings from yesterday and today's webinars, the slides, and responses to your questions. So now that we've received all of this information, where do we go from here? So now that the pilot programs have concluded, in the next few weeks, Mental Health America will issue a report analyzing the data that we and our affiliates who you've heard from have collected and shared. We capture data on replicability and scalability, return on investment, and the economic impact on marginalized populations, so that others may take these pilots and back to their communities and organizations, adapt this to either scale up or scale down a program that would fit best for the people that you serve. And this would overall increase the amount and the level of support to healthcare workers across the country. You've also heard, and I've seen some comments in the chat referencing how these pilots could also be adapted for other populations, so who could benefit from this support as well. Thank you so much for your time, and we appreciate the opportunity to present for you today.
Thank you, Jenny, and thank you to all of our affiliates who are here with us. Thank you to everyone who joined to listen in today. Just a reminder, you will get the recording of today's session and yesterday's session in case you missed that one that featured other affiliates that were doing this great work. It's just fantastic to hear that the work you're doing in your communities is making such an impact. And we thank you all for being here, sharing that with others. So hopefully this work can spread and continue into additional communities. So really, thank you, Jenny, and thank you, affiliates, for being here and for the work that you're doing every day in your organization. Thank you all for joining. Again, you'll receive this information within the week, and any questions that were asked in the chat will include follow-up and answers to those from our speakers today in your materials that you'll receive with the recording, the slides, and those materials Jenny had mentioned. So thank you all. Have a wonderful rest of your afternoon. And thank you, presenters.
Thank you very much.
Thank you.
Thank you.
Thank you, Jenny. Thank you.
Thank you.